Navigating healthcare, well, it can often feel like you're trying to piece together a really complex puzzle, can't it?
Mm-hmm.
Especially that moment when you're leaving the hospital, going back home.
Yeah, you've been through treatment, you're focused on recovery, and you're just ready to get out of there.
Exactly. And you might get a few last-minute instructions, maybe, a piece of paper handed to you.
And for a lot of people, that piece of paper, this document they get, it just feels like one more thing to deal with when you're not feeling great and just want your own bed.
Right. But this one document we're diving into today, the hospital discharge summary, it's actually much more powerful, more essential than you might think at first glance.
Definitely. It's not just some administrative formality.
No, it really is your key to continuity of care and, honestly, to avoiding some potential problems down the line.
Absolutely.
So our ambition in this deep dive is to unpack what this summary is, why it's basically your best friend after you've been in the hospital, and how knowing what's in it and, importantly, what you need to do with it connects you to these bigger efforts happening worldwide to make healthcare safer and, well, more reliable for all of us.
And understanding why certain information is included and the process hospitals, should be following when they discharge you, that ties directly into the quality and safety standards set by major organizations.
Ah.
It gives context to why getting this document right is so incredibly important.
Okay, let's get into it then. What exactly is a hospital discharge summary? What makes it different from, say, a nurse just saying, okay, you're good to go home now?
That's a great question. So it's a formal, pretty detailed document. It comes from the hospital or the specific medical team that treated you.
Okay.
And it acts as a really comprehensive overview of your entire hospital stay. Think of it less like a quick sticky note and more like the official record of your medical journey during that specific admission.
Gotcha. So it's not that little maybe 1 or 2 line discharge card slip some places might give out. We're talking the full report here.
Precisely. This summary, it captures all the essential information someone else like your regular doctor or a new specialist needs to know about your recent health event.
Okay.
It usually starts with the reason you were admitted in the first place, the symptoms that brought you in, or what they initially thought might be going on.
And then what the medical team actually figured out. The final word.
Yes, exactly. It includes the final medical diagnosis. So if you came in with that high fever and it turned out to be dengue or, severe stomach pain that was appendicitis, that diagnosis should be clearly stated right there.
Okay, so diagnosis, check. What else is typically packed into this summary?
Well, it summarizes all the diagnostics and interventions. So any tests they performed.
Blood tests, things like that.
Yeah, blood work, procedures, any imaging scans like x-rays or CTs, maybe MRIs, or of course any surgeries you underwent.
Right.
It also lists the treatments you received while you were in the hospital. That includes all the medicines they gave you during your stay.
And it should also tell you about your condition right at the point you're leaving. Like, were you stable? Did you still need some kind of assistance?
Yes, definitely. It describes your condition at discharge. And it often includes what's called the hospital course.
Ah, the hospital course. That's sort of the story of this day.
Kinda, yeah. It gives a narrative of your progress, key events, how things went during the stay, and crucially, it includes a detailed section on medication instructions for after you leave.
Okay, this feels super important.
It is vital. This part specifies any new medications you need to take, any changes to medicines you were already on, or any medications that were stopped.
And it needs details right, not just the name.
Absolutely. It should list the exact name of the medicine, the precise dose, when and how often to take it, and for how long. This clarity is key.
Yeah, I can see how that medication piece is just non-negotiable for safety once you're home. Right. What about next steps, like appointments?
That's covered too, usually in the follow-up plan section. It details any appointments you need, whether that's with your primary care doctor, specialists, or maybe physical therapy.
Okay.
It should also list any lab work or imaging tests you need to get done after you've been discharged.
Plus, maybe things like don't drive for a week, or here's how to care for your incision.
Exactly. Any activity restrictions like limits on driving, lifting heavy things should be specified. And yes, any instructions for wound care if you had surgery or an injury.
Makes sense.
And importantly, it should also list the red flags.
Red flags, what do you mean?
Warning signs, symptoms you need to watch out for that mean you should call a doctor right away or even head back to the emergency room. Things like developing a fever, unusual swelling, persistent chest pain, shortness of breath. Depends on why you were in.
Got it. Those are critical to know. And I assume contact info too.
Yep, details or contacts for the treating doctors, maybe nurses or a case manager you can reach out to if questions come up.
And, of course, all your basic details are on there too. Name, age, hospital ID number, gender, that sort of thing.
Right. Your identifiers need to be correct.
Wow, it really is a comprehensive rundown when done properly.
It absolutely is. And, understanding these different parts is just the first step. The real power comes when you recognize why you need this document so badly and what it really represents in your whole healthcare journey.
Okay, so let's dig into that because this is where it gets, like you said, really interesting. Why is this summary so vital that we're calling it your health passport? What makes it more than just, another piece of paper and a file?
Well, let's paint a picture. Imagine you see a new doctor, maybe a specialist, for the first time right after you've been in the hospital.
Okay.
This summary. It's their fast track. It gives them a clear, verified snapshot of what just happened to you medically, the diagnosis, the treatments you got, how you responded.
So they're not starting from scratch.
Exactly. It saves a ton of time, helps them make accurate decisions much faster, and importantly, can help avoid repeating tests that were just done. It's absolutely essential for that seamless continuity of care.
Right. Makes total sense. And just for practical day-to-day recovery, getting those medication instructions right, that's huge. This document is the official word on that.
It's the definitive guide, the source of truth for your post-discharge meds. And then beyond the clinical side, think about insurance.
Ah, yes, the bills.
Right. It's often mandatory for health insurance claims and reimbursements. It serves as the legal proof of your hospitalization, the diagnosis, the treatments provided, and crucially, the medical necessity of the care you received.
So without it, claims could get stuck.
They can get significantly delayed or even outright denied. It provides the justification insurance companies need.
Which is the last thing you want to deal with when you're trying to recover. So it really does serve as a critical legal and financial record of your treatment, too.
It absolutely does. And think about future hospital visits. It's often required if you need to be admitted again, particularly if it's to a different hospital or health system. They need that recent history readily available.
Good point.
And ultimately, it's just a cornerstone of your personal medical history record keeping. You are the most consistent person in your own healthcare journey, right?
True.
Hospitals might archive records after a while. Systems might not talk to each other. You might switch doctors. You might move cities. You being the primary custodian of your key medical documents, like this summary, is just essential for managing your health long term.
Okay, it's crystal clear you need this document.
Yep.
But you also have a part to play, right? Before you even walk out of the hospital doors to make sure you get the right info. What should you be doing?
Right. This is about patient responsibility and rights. First and foremost, you need to ensure you actually receive a physical copy.
A paper copy.
Yes, a printed paper copy that is signed and stamped by the hospital or doctor. This is generally your legal entitlement. Now, hospitals are increasingly offering digital copies too, maybe through email or a patient portal.
Which is convenient.
It is convenient. Definitely ask for that if it's available. But still, get that printed one. It's crucial, especially if you're going to see doctors outside that specific hospital's network who might not have easy access to their electronic system.
That's a great pro tip. And another one, if English isn't your first language, or maybe not the first language, of the person who's going to be helping you recover at home.
Oh, good point.
Ask if they can possibly provide the summary in a local language as well, if that's something they offer. Understanding those instructions clearly is just paramount.
Absolutely critical. And this next part is where your active participation really comes in. Do not just take the paper and leave.
Okay.
You need to review it. Verify the information on the summary, ideally with a healthcare provider, a doctor, or a nurse before you go. Take the time.
What should you be checking specifically?
Start with the basics. Are your personal details correct? Name spelled right? Correct date of birth? Hospital information accurate?
Okay. The easy stuff first, then the medical bits.
Yes. Look closely at the medical content. Does the final diagnosis listed match what you understood it to be from the doctors? If you had surgery, do the notes seem right? And crucially, is that discharge medication list accurate? Does it make sense?
And if something doesn't look right, or maybe it's just confusing,
Ask. If anything is unclear, if there's medical jargon you don't understand, ask the doctor or nurse to explain it in simple, plain language. Don't feel embarrassed or like you're holding them up. It's your health.
right, you have the right to understand.
Exactly. And there are some specific checks that are particularly critical, especially around medications.
Yeah, medication safety seems like maybe the #1 risk point at discharge. What should you specifically look for there?
Okay, so verify every single medication listed on that discharge sheet. Compare it carefully to the medications you were taking before you came into the hospital.
The reconciliation step.
Precisely. Ask direct questions. Are these new medications for me? Are any of my old medications being stopped, or should I keep taking them? If they're stopped, when did that happen? Get crystal clear, written instructions for any new drugs, the exact dose, the specific time of day to take it, and ask about potential side effects and what to do if they happen.
That clarity could prevent a serious error at home. What about those follow-up appointments you mentioned?
Confirm them. Don't just assume the hospital has automatically scheduled everything for you.
Really? They often don't.
I often don't know. It varies. So ask directly. Have these appointments been made? If not, can you help me book at least the first critical follow-up before I leave? Make sure you leave knowing exactly who you need to see and have a plan for when.
Okay. And thinking about support needed at home.
Yes. Discuss any potential home care needs.
Mm-hmm.
Do you anticipate needing a visiting nurse?
Mm-hmm.
Physical therapy at home? Maybe medical equipment like a special bed, a walker, or oxygen? And importantly, while you're still there, ask about getting insurance pre-approval for these services. Some insurance plans require that authorization while you're still technically an inpatient.
Good tip. Avoid surprises later. Now, activity restrictions, I can see how getting those wrong could cause a real setback in recovery.
Oh, absolutely. Don't settle for vague instructions. Get specific clarification on your limitations. When exactly can you shower? How much weight precisely are you allowed to lift? When is it truly safe for you to return to work or driving? Misunderstanding these can easily lead to complications or even needing to be readmitted.
Yeah, definitely want to avoid that. And let's not forget the financial side, which often becomes a headache after discharge.
Right. While you're still in the hospital, or at least know who to contact right after, ask about getting a fully itemized bill. Review it for errors.
Okay.
And here's a critical one. Ask if all the different providers who treated you during your stay, think surgeons, anesthesiologists, radiologists, maybe consultants, were considered in-network for your specific insurance plan.
To avoid those surprise out-of-network bills.
Exactly. Flagging that possibility early can sometimes help you navigate it better.
Are there any particular discharge red flags you should be looking out for, either in the document itself or just in the process, things that should make you pause?
Yes, definitely. Vague instructions are a big one, like if a medication says take as needed but doesn't specify what as needed means, like how often is okay, what's the maximum dose in a day, that's too vague.
Yeah.
Another red flag is a discharge summary that doesn't list a clear follow-up plan, or one that seems to kind of brush off unresolved symptoms, maybe saying something like pain may improve over time, but gives no guidance on what to do if it doesn't improve or if it gets worse.
Right. You need a concrete plan B.
You do. If you see things like that, push for clarification. Ask for concrete details and specific instructions.
Any other sort of pro tips for navigating that crucial moment of discharge smoothly?
Yeah, a couple more. If possible, bring a trusted family member or a friend with you for the discharge discussion.
A second set of ears.
Exactly. An extra set of ears to listen, maybe ask questions you forget in the moment, and help take notes. It's invaluable, especially when you're probably not feeling 100% yourself.
Good idea.
Also, as soon as you get those discharge papers, take a quick photo of each page with your phone. Instant backup.
Smart.
And make sure you leave with specific emergency contact numbers, who to call from the hospital or your care team if you run into trouble, or have urgent questions after hours.
Excellent tips. So it's really clear that getting the document right and reviewing it before you leave is critical.
Yeah.
But your responsibility doesn't just stop at the hospital exit door, does it?
Not at all. How you manage your discharge summary after you get home is just as important for it to be useful.
So what's the first step once you're home?
Organization.
Hmm.
Sounds simple, but it's key. Set up a dedicated health folder. Could be a physical binder, could be a digital file on your computer for each member of your family. Store that discharge summary in there. And keep it together with any related documents from that same hospital stay, like copies of important test results, imaging scan reports, maybe on a CD, prescriptions, and any insurance claim forms or explanation of benefits related to that visit.
Basically becoming your own health information manager.
That's a great way to put it, exactly. And don't just assume the hospital will keep your records perfectly accessible forever, or that their electronic system will magically talk to every single other doctor or clinic you might ever visit.
That doesn't always happen, does it?
Doesn't always happen seamlessly. Hospitals might archive older records, making them harder to retrieve quickly. Different electronic health record systems don't always communicate perfectly across different healthcare networks or cities. You need to be the primary custodian of your own essential medical history.
And having it organized like that makes it super easy to grab when you need it for those second opinions or follow-up visits with specialists we talked about earlier.
Absolutely. It saves everyone so much time. The new provider gets a clear picture quickly, and it helps prevent them from having to guess about your history or ordering tests that were literally just done a week ago.
Cuts down on waste and speeds up care.
Precisely. It really is a game changer for ensuring accurate and timely care going forward. And here's a really practical step you should take quite soon after getting home, maybe within the first 24 to 48 hours.
Good.
Call your primary care physician's office,
Yep.
your PCP, your regular doctor. Let their office know you were hospitalized, what for briefly, and that you're now home.
Doesn't the hospital automatically do that?
You'd think so, and sometimes they do, but honestly, that communication loop isn't always reliably closed. It's much safer for you to proactively update your PCP yourself. They need to know what happened.
Good advice. Don't assume. And keep those red flags from the summary top of mind, right?
Definitely. Know what those specific warning signs are for your condition. Know when symptoms mean you should call your doctor's office or maybe a nurse advice line if one was provided, or even when it's serious enough that you need to head back to the ER. Being aware of those specific signs can make a huge difference in catching potential complications early.
Right. So this level of patient engagement, actively managing your information, understanding your instructions, it feels like it's not just good personal practice anymore. It's becoming part of something bigger.
It really is. It's a tangible part of a much larger systemic effort that's happening globally to improve the quality and safety of healthcare.
Okay, so let's zoom out a bit. What does all this focus on the discharge summary and the process around it really mean in the grand scheme of things? Why is there such emphasis on getting this right? And why does your understanding as a patient actually matter?
Well, because clear communication and safe transitions of care, like going from hospital to home, are absolutely fundamental to patient safety. And these processes, like discharge planning and documentation, they're heavily influenced by organizations that set quality standards for healthcare.
Okay, like who?
Well, globally, you have organizations like Joint Commission International, usually known as JCI. They're recognized worldwide as leaders in setting these really rigorous international standards for quality of care and patient safety.
And they work everywhere.
They work in over 70 countries, accrediting hospitals and various healthcare programs. Their whole vision is centered on achieving zero harm for patients and promoting highly reliable care practices.
Wow. So they set the international benchmarks that good hospitals aim for.
Exactly. And their standards cover a huge range of things, from how hospitals prevent infections to how they manage medications safely, and yes, very specifically, how patients are safely discharged with clear instructions and plans for continuity of care. That detailed discharge summary process, it's a direct outcome of these kinds of quality and safety imperatives.
Okay, so that's the global picture. Does this happen on a national level too?
Oh, yes, absolutely. In India, for instance, you have the National Accreditation Board for Hospitals and Healthcare Providers, which is NABH.
MAT.
They're part of the Quality Council of India, and they play a very similar role, but focus specifically on the Indian context. They establish specific accreditation programs and quality benchmarks tailored for the Indian healthcare ecosystem, really working to build what they call an ecosystem for quality.
So setting the standards within the country.
Right. And then you also have organizations, maybe like specialized consultancies. Supremedic is one example that work directly with hospitals and healthcare systems.
What do they do?
They help these hospitals implement the necessary best practices and actually meet the standards set by bodies like NABH or NABL, which focuses on laboratory standards. They help improve everything from hospital infrastructure and processes to ultimately the patient care protocols.
So they help hospitals get up to speed with these quality measures.
Exactly. So when you as a patient receive that detailed, hopefully accurate discharge summary, you're holding a document that is, in a very real way, a product of these significant global and national pushes for better, safer healthcare.
Huh. I never thought of it that way. It's not just a form, it's part of a system aiming for quality.
Precisely. It's designed, ideally, to be a reliable link in a chain of care within a system that's constantly being evaluated and pushed to improve itself. It's meant to empower you by giving you the critical information you need.
It really is designed to empower you, isn't it, by giving you that knowledge?
It absolutely is. And when you use it effectively, when you understand it, share it with your next provider, follow its instructions. You're helping to ensure that your care journey continues safely and smoothly after you leave the hospital walls. You're playing your part in making the system work better.
Which brings us nicely to our key takeaway today, I think. It boils down to get your discharge summary, keep it safe, and make sure you truly understand what's written in it.
That's the core message. It contains such vital information about your recent medical event, your ongoing treatments, your future care needs. It really empowers you to make informed decisions about your own health and ensures those smooth transitions between different healthcare providers. Don't ever underestimate its power for your health and your well-being.
Yeah, it's definitely more than just administrative paperwork. It's a vital piece of your personal health story, and it's a tool for navigating what can be a really complex healthcare system. So as we wrap up, here's maybe a final thought for you, the listener, to consider. In this increasingly complex healthcare world, one that's more and more focused on quality standards and patient safety, how does your active role, just by doing something as seemingly simple as demanding, safeguarding, and truly understanding your discharge summary, how does that become not just a benefit for you personally, but actually an essential layer in that much broader effort to achieve better health outcomes for everyone?
It's a great question to ponder. Your engagement really does ripple outwards.